Excellent. We're going to be giving an example of glottis treatment. And to start, we're going to test Kat's glottal reflex. Okay, Kat, go ahead and face me. For people familiar with the IPA, this is similar to a lumbar protective mechanism test. We're just going to see how her glottis responds when an external force is applied. So go ahead and put your right hand up, and then I'm going to feel from the glottis as I put a force into her. And does she stabilize right away? She gets some small deviations. So the glottis is not having an excellent reflex to come on. Let's check the opposite hand here on the left. Same thing. She gets much more stability from her left. So we might use her left to bring in her right a little bit more. We'll have her get down on the table, and we'll clear out any mechanical restrictions first and see if we can improve her glottal reflex. Courtney, go ahead and come around this. Actually, no, this way is better. You're right. We're going to treat from this side. Okay, and you can even come in more. I kind of want you to see, can you come around this angle here and just see if you can see where my hand is going on Kat. So the first structure we're going to look at is her hyoid bone, and I want to see how well hyoid bone, if we're looking, we're going to come to her thyroid cartilage here, and the hyoid bone is going to be up behind the thyroid cartilage, sort of over the area of C2. Some people C1, C2, and I'm checking. And again, just getting your hands on your patient, trying to help them relax, as this is a place where they can gag a lot. You doing okay, Kat? Mm-hmm. So I'm going to check, can the hyoid move lateral, left to right? And she has more restriction going to her right. So I'm just going to hold that there. And she did exactly, I didn't even have to ask her. She swallowed for me, and that's helping me mobilize this to the right. So opening up the glottis to the right, again, beautiful swallow. That's helping me get it to move. Then we want to check, can it move anterior, inferior, and can it move superior, posterior? Go ahead and just tuck your chin down a little bit, and what it should happen is the hyoid should tuck up into C1, and hers moves pretty good up into that direction. Go ahead and relax again. Does it come down? And it doesn't want to come down quite as well. So what I'll have her do is I'll actually just hold onto her hyoid. Again, it's a little uncomfortable. And I'll have her do just a couple little chin tucks as I stretch her hyoid bone down. Great. Fantastic. And for the purposes of this presentation, Kat's being a real trooper. We're trying to go fast to get through this in a reasonable time. Okay, now I'm going to go ahead and just check her myohyoid structures, or how much motion she's got from her tongue. And because there's some restriction here holding the hyoid up a little bit, what I'm going to do is I'm going to grab some gloves, and we're going to just treat sublingually a little bit of her myohyoid structures. Excellent. And again, Kat's doing pretty good, but if the patient is gagging, there's a spot here on the lip where you can just put some sensation into to try to get it to reduce. Some lidocaine-based sprays can help in reducing the amount of gagging. But we want to help the patient, so we're not going to let gagging be a deterrent to us, okay? I'm going to go ahead and take Kat's hand and just put it here in my forearm. That way, if she feels uncomfortable, she can push my hand away right away. Okay, Kat, open up, and we're just going to come right under your tongue, and I'm going to come in, relax the jaw now. I'm going to come in and see if I can feel any tension between her myohyoid muscles going into that hyoid bone. Okay, see if you can give me a swallow on that one. Excellent. I know it's not easy. Same thing, opposite side. Try to let your tongue relax a little bit. And one more swallow for me. Great job. Kat's being a trooper, and she's hanging in there. That is a quick one, but just getting a little release on her hyoid. Give me 2 seconds. I'm going to wash my hands. And we'll come in and we'll check hyoid again. Still feeling okay, Kat? Mm-hmm. Excellent. And that gives her much better motion to the left and to the right. So the next structure I want to come in is up behind that is her oral pharynx, which is sort of just the back of her throat, and seeing how much mobility I can get behind the hyoid up into her oral pharynx. Now I'm feeling some restriction and going the opposite direction to the left. And had we not treated the hyoid, if we just came into here, this would probably be causing gagging and be very uncomfortable for her. So go ahead and just give me one more swallow. Good. And again. And the swallow itself is giving me a little bit of contract and relax to get this to slide to the left better for her. Beautiful. Seeing mobility into the oral pharynx. Next, we'll slide down to the larynx itself, where the glottis is encapsulated. And what we want to do is make sure that the esophagus and the larynx can come up off of the cervical spine. I want to note, side note, that you would clear all the cervical spine and upper thoracic restrictions before you did this. Cat's cervical spine was moving great, so we could jump right in this to give you this example quickly. So you can see I'm coming underneath the larynx and just making sure that it has ability to clear up and superior off of everything. Okay, beautiful. Now we'll specifically come to her thyroid cartilage, which in the male you can see is the very pronounced Adam's apple. Here in cat I can feel where it drops off right there. So that's her thyroid cartilage, below which would be the start of her cricoid cartilage. And what I want to do is feel laterally, can the thyroid cartilage move separate from the cricoid cartilage? That's not too bad. I'd say moving left, when I block the cricoid cartilage, moving the thyroid cartilage left has a small more restriction. So again, we'll use, let's try chin tucks here to see if we can just get some more mobility on that. And that caused her to swallow too, so that's helpful. Opening up that thyroid cartilage. You feel that big change of how much more motion we created on that? And that little click is normal. That's just the back of the cartilage sliding over the tissue underneath it. So don't be afraid of the click. Now blocking the thyroid, can I move the cricoid? Exact opposite restriction, that moving left. So same thing, we'll try a chin tuck there. And that's causing her to swallow. The swallow is giving me even a better functional mobilization. Okay, now I just want to see, can the thyroid and cricoid, you can see my hands on there, the thyroid and cricoid cartilage, as she moves back, can it gap open like this? So go ahead and just gently extend your neck, and do we get gapping between the two? And do we get it on both sides? Okay, come back down again. Feeling some more restriction on the left. So we'll just block it from going left. So block it from the left, and we'll just have her just gently do these extensions as I gap the cricoid to thyroid cartilage. Excellent, beautiful. We'll test the glottal reflex again here by having her create her own external force, which will be, cat, just push both feet into the table. And relax. Same thing again, push again. Okay, so she's still getting some glottal motion here as she's pushing. So we're gonna use some P&F and irradiation. Cat, both hands up like this. Don't let me move you. And don't let that slide. Tongue on the roof of your mouth and just hold that there. Keep it closed. So we're seeing when we shift to the left, does the left side of the glottis contract to hold that in place? And that's coming in. Her irradiation is getting that to come in. And as we slide right, is the right side coming in. Go ahead, hold again, and we're not going to let that move to the right. Excellent. Excellent. That's coming in, cat. Good job. Okay, so we're getting a little glottal reflex from some irradiation. That's fantastic. The last thing we're going to check, we won't embarrass anyone too much, is just sound production. So can you give us a nice ah? Beautiful on the right, but we're petering out a little on the left. So what we'll do is I'll oscillate her to the left, and I'm going to do some quick stretches, and you're going to try to fight through that restriction that you're feeling on the left. So again, same thing again. Ah. Good, good, good. One more time, same thing. And already her sound quality is improving. She's going to be a new woman when she gets up off the table. Okay, cat. That was quick glottal treatment, just to go through things very quickly. Again, manage cervical and thoracic, and we can go through each individual soft tissue structure more. But for the purposes of this example, we're going to have you come back up, and we're going to test your glottal reflex in standing again to see if we don't have a better response. Just left hand up, and don't let me move it. and she's way more solid. There's way less motion here. Same thing this side. She's going to be 100%. She's going to be more efficient at treating. And this all goes into what we talked about earlier in this presentation. And if you can control air coming in and out of the system, you're going to have a more stable base. Beautiful. Feel okay, Kat?
Mm-hmm.
Talk. Say something. Say, hi, I'm Kat.
Hello, I'm Kat.
Beautiful sound. Great. Okay. Thank you, Courtney.